Well, it's no surprise that burnout in the healthcare sector has been mounting as this pandemic has been dragging on. The onset of Omicron and the need for a rapid rollout or vaccinations isn't going to offer much relief. While many sectors within healthcare are already suffering from staffing shortages, increased pressure on hospitals, COVID-19 protocols, and the redeployment of staff for the latest vaccine campaign are of serious concern. So for more on this, we are joined live now on CP24 Breakfast by Dr. Rick Tytus, who is an associate clinical professor in the Department of Family Medicine at McMaster University, and he's also the co-founder of Banty. Dr. Tytus, thank you so much for joining us to talk about this really important and dragging issue, this issue of worker burnout. What are you seeing and what are you hearing?
Well, the OMA did a survey last year, or actually this year, March of 2021. It was published in August 2021. At that time, it surveyed its members, the physicians, and 34.6% of physicians were experiencing burnout. Well, the Hamilton Academy had an educational event last week, and we posed the same question. And the question was, are you experiencing burnout? And the response was 72%. So in the last 9 months, the burnout rate went from 34% to 72%.
Wow. So it has really grown. Dr. Tytus, we talk about worker burnout and we also talk about COVID-19 fatigue. Are these the same thing or are they different? And what are the implications if healthcare workers, doctors are feeling either of these things?
Well, the issue with the burnout is doctors are now really overwhelmed. They're becoming less functional and even depressed, and we know what that leads to. So, again, it's on one hand we're fighting the COVID, we're trying to get people vaccinated with COVID booster, flu booster, and then we're dealing with patients with hesitancy, and also we're dealing with patients that aren't coming in for the chronic disease management.
Dr. Tytus, do you think that we're at a tipping point in Ontario with the onset of Omicron?
Well, I think we have to do things differently. So I think we're on the verge of utilizing technology more when it comes to healthcare. When it comes to doctors, I think it's an opportunity to use more digital tools to be more efficient, to provide better patient experience. When it comes to patient, I think it's important that we now use the technologies we have, like the home remote monitoring, like when it comes to blood sugar or when it comes to blood pressure, so we can prevent patients from having to come to the office, provide them a safe environment so we can actually see them at home.
Okay, Dr. Rick Tytus, Associate Clinical Professor at McMaster University and co-founder of Banty. We really appreciate your time to talk about this really important issue. Safe holidays and good luck to you. Take care.